So I get asked this question an awful lot. It comes in different variations, but essentially it is hormone therapy, either estrogen or testosterone therapy, going to be affected, or is it going to affect some medication that I am currently taking? This can be just about any medicine. We usually, get people writing in because their primary care provider just put them on a new medication and they want to know, is it going to interact in any way with their hormone therapy? By and large, the short answer to just about any of these is no, it's not going to interact in any significant way. There are a couple of very small exceptions and stuff, but in general, no. I'm going to address a couple of specifics just because I get these an awful lot. The first would be blood pressure, diabetes, cholesterol medications. So these medicines they're not affected at all. Don't even worry about it. There's no significant interaction that I have seen or that I have seen in research to show that either testosterone therapy or estrogen therapy is going to adversely interact with any medications typically used to treat blood pressure, diabetes, or cholesterol issues. The next question is, people will ask, hey, I'm going to go get a COVID vaccine. Hey, I'm going to go get my flu vaccine. Some variation of that. Is the hormone therapy going to affect that in any way? No, it won't. It won't have anything to do with it. The most common question about that I get is, hey, I'm supposed to give my shot today, and I'm also supposed to get my flu shot or COVID shot, whatever the case may be. And they say, should I get both shots on the same day? Yes, it's perfectly fine. You can do that. It's perfectly fine. Now, the next that is asked is, I'm on a pain medication regimen. Is it going to affect that? No. To no significant degree that I'm aware of does testosterone or estrogen therapy interact with, pain medications themselves. The next category is one that I get asked an awful lot. Mental health medications, such as those for depression or anxiety or bipolar or ADHD. So this is a bit of a tricky question to answer because, just for example, say if someone has ADHD, going on testosterone therapy, in my experience, this is anecdotal, this is not through research, but in my experience, I have seen that some people do see a somewhat temporary exacerbation of their symptoms whenever they first begin testosterone therapy, maybe the first 6 months or so, and things calm down generally after that. Not everybody experiences this. It's a relatively small amount of people, maybe 10% or less. But some people do experience kind of an exacerbation of their ADHD symptoms whenever they go on testosterone therapy. I have not had really the same report from those on estrogen therapy. Here and there I have had someone say, it seems like my symptoms are better, or it seems like maybe they were a little bit worse at first, but it's very few and far between that I get people discussing their estrogen therapy seems like it was, affecting their symptoms. And that's not, really the medicines, the hormones themselves interacting with the medicines people are taking. It's literally just like you're going through a second puberty and your hormone levels are now cycling up and down, and depending on the medication regimen you're on, it could be cycling up and down every day, like if you're on a gel, or it could be cycling up and down, through the week if you're on injections or so. So it's not the medicine interacting with the mental health medications. It's just that it is interacting physiologically with your body, and that is how it's causing these things. But anyways, so to no extreme degree or to no great degree that I am aware of have I seen evidence that testosterone therapy or estrogen therapy has caused adverse effects to people's actual medications that they're taking for various mental health concerns. Now, that being said, one thing that I do keep in mind is that whenever you go on hormone therapy, it does slowly like change your neural architecture over time. Just, it's not like you get a whole new brain or something like that, but whenever people say, I'm wired different or something, this is kind of what I mean, is like it wires you a little bit different. And so you may find over time, not instantly, but you may find over time as these changes in your brain occur that, let's say if you started out on a very common antidepressant medication such as Prozac or Zoloft or something, you may find that it is not as effective, or you may need something different or whatever. Of course, that could also be because those medications, people tend to get used to them over time as well, and they tend to not work as well once you've been on them for more than 1 or 2 years. So that's kind of subjective there. Don't really know that the whole neural changes is going to be what is causing that. It could just be that the medicines themselves are decreasing in effectiveness, and therefore you need something different. Or as we age, our neural architecture is going to somewhat change as well. We lose a little bit of the filling up here as we age. It shrinks, and because of that, different medications can affect our brains in different ways as we age. So I don't really have a lot of proof that the medicines themselves are what's causing this interaction, so to speak. It seems more likely that it's, again, a physiological change. But again, nothing worrisome and nothing like instantaneous and scary or anything like that going on in regards to mental health medications. Another one to be aware of is thyroid medications. So not so much for estrogen therapy, but more on the testosterone therapy. So there are actually some studies out there and some commentary out there that does seem to point to, if you're on thyroid medicine and you go on testosterone therapy, that there is a chance, not guaranteed, just a small chance, that it may alter the way your body is able to utilize that thyroid medication. And all that means is that you may need a different dose of thyroid medication. And I mean, this is something that whenever you're talking to your provider, y'all are doing labs to make sure your levels are good. You're also, telling them how you're feeling, if you're having any symptoms of hypo or hyperthyroidism. And so this should be something that's relatively easy to kind of catch, hey, I'm starting to feel like I did before I was on medicine, but yet I'm on medicine, so what's going on? What's new? Well, you went on testosterone therapy. That could be part of it. But like I said, that doesn't mean that testosterone therapy is bad for people that are on thyroid medication. It just means that there may, down the line, be a necessity to change dose or something like that. So just something to kind of be aware of. The last topic I'll talk about is steroid medications, and this is more like people that take prednisone, solumedrol, stuff like that, and that's more like by mouth, not the inhaled kind that people with like asthma or COPD, other lung problems, might be taking. This is more like, you're having an allergic reaction and they sent you home with, one of those little steroid packs that you take. Or you have some kind of a crazy rash and they give you a steroid shot and send you home with some prednisone to follow up taking. So if you're on prednisone or solumedrol or any of these steroid medications for a short term, like less than 4 weeks, I'm not really worried about testosterone and estrogen therapy either affecting it or it affecting your hormone therapy. Now, there are some cases where people will go on these things for long term, like they'll be on prednisone or something like that for very long term, months, years, which is usually ends up pretty terrible for the person because it can make their bones brittle and, other things, makes their fat in their body shift around to be shaped differently. Whenever you're going to be on a steroid long term like that, meaning months to years, it can cause a difference in the way that your body is processing and reacting to these hormones. that I'm aware of. I have not seen studies on this. I have not done a deep dive though into looking for these. Just the way that these steroids are processed in the body, you know, and the way they affect the body, affect the changes that you're expecting on hormone therapy. Like, for example, with estrogen therapy, you're certainly expecting fat on your body to redistribute in a more feminine pattern, but that's going to be a real problem when taking prednisone for the long term is going to cause fat redistribution of its own, a different kind of pattern. So that could become kind of problematic for someone, you know, both steroid and taking estrogen and testosterone. And also, to be clear, estrogen and testosterone themselves are steroids. They're sex steroids. And, you know, these other steroids that I'm talking about fall into kind of a different classification. You know, they're either corticosteroids, glucocorticoids, things like that. But they do kind of have some crossover here, like I said, with the fat redistribution. That could be problematic for those who are kind of wanting that fat redistribution that the hormone therapy from estrogen or testosterone is going to cause. It may get screwed up from long-term prednisone use. That doesn't mean that you can't go on, you know, gender-affirming hormone therapy. It just means be aware that your changes may be impeded or changed in some way if you're on long-term steroid therapy with prednisone, solumedrol, or something like that, solucortef, all these other things. So anyway, I know there's a lot of other medications out there and everything, but I wanted to hit these. These are the ones that are most common that I get asked about a lot, and they're also the most common. You know, these are meds that people get prescribed quite commonly. It's not, you know, just random rare medications. But I mean, off the top of my head, like I said, there's nothing else that really crops up that I'm like, oh, dang, if you're on XYZ medicine, it's going to interact. Like, there's nothing out there that's really going to contraindicate starting hormone therapy for gender affirming care, as far as medications and being worried that medications and the hormone therapy are going to interact or cause some kind of bad results. So anyways, hope that helps calm some people, because I know I've had a few patients tell me that they were hesitant about starting hormone therapy because they had those questions in their mind, like, does it affect it? I'm not sure if I can do this because I'm on bipolar medications. I think I've covered that in another video, that yes, you can be on hormone therapy if you have bipolar disorder. Like, that's fine. It's fine. It's not a thing that will prevent you from getting on hormone therapy, at least not at our clinic. Anyways, so everybody have a fun day, and hope this helped. Bye!